Hello, everyone. My name is Dimitri Trejo, and I am the Communications Manager for the RGV School of Medicine and Division of Health. And today we have with us Dr. Jose Campo Maldonado, and he is the Director of Infection Surveillance. And today he's going to be talking to us about COVID-19 and precautionary measures to take. Good morning, Dr. Campo. Tell us a little bit about yourself.
Good morning, Dimitra. Thank you for this kind introduction. Well, I am an assistant professor here at RGV School of Medicine. And as you say, I am the Director of Infection Surveillance. And more than anything, I like to communicate to the public things that are important for them to protect from this pandemic. And I'm happy to be here because of that.
Well, thank you for taking some time to answer some of these questions. Now, these questions have been developed by our marketing team, and I think these are just some questions that people have, they're interested to know. And so we're just going to start right away. And the first question is, why is the disease being called coronavirus disease 2019 or COVID-19?
Initially, when this came out, that it used to be called novel coronavirus, but the ones who decided to choose that name, they use many different criteria. I think one of them is that the public can recognize and understand and not get it confused with other types of infection that may have similar names. And there is a name that can be recalled and referred to so people understand what we're talking about. And that was the WHO, the World Health Organization, who set up that name. And the name that they chose is COVID, which is coronavirus disease. And 19 is the year when it was identified. The disease was identified. But there is a different name that is used for the virus. But in general, people, I think, understand better when we talk about COVID-19 because it's the more popular name.
The next question would be, what are the symptoms of COVID-19 or the coronavirus infection?
Yes. Thank you. That's an important question. I think there are some symptoms that everybody needs to recognize. I will divide it that way. And symptoms that probably is more important that the healthcare providers recognize, right? Because there is a broad spectrum of possible symptoms. Let's remember that that COVID-19 is a disease caused by a virus that is predominantly a respiratory virus. Can it go to other places? Yes, there are studies that have documented that the virus can go to your heart or can go to the gastrointestinal tract, but it usually goes through your nose, through your oropharyngeal mucosa, which are all the pink areas inside of your nose and your eyes, right? And then it gets there in some way, finds its way to go to the lungs and causes a disease, which is usually cough and fever. They don't necessarily present at the same time. Other people have also reported myalgias, which means body aches. So those are kind of predominant symptoms. Can the virus cause runny nose? Yes, but it's a small group of people. Let's remember one thing about this virus. Things change so fast. So what I say today, if it's revised later, you'll understand. But what we know so far is that predominantly, those are the predominant symptoms.
The next question is, how is COVID-19 or the coronavirus different from the flu?
Yes, that's an interesting question because there are similarities, of course, and differences on this virus. There are different types of viruses. The influenza virus is one thing. The coronaviruses are different too. One different thing is that the flu has been established as a seasonal virus. We know that it changes a lot, but we also have vaccines. And every year we can get a vaccine. That means that we can protect the whole population from the virus. And if some people are immune, they are not going to transmit the disease, or they are less likely to transmit the disease, right? Or to get it. We don't have that with this virus. Similarities, both are respiratory viruses. So the transmission modes are similar. Although there is a concern that the COVID-19 may have some forms of transmissions that are slightly different from the flu, but those are maybe not as important as the other mode of transmission that we are aware of, which are droplets, right? When we talk, when we sneeze, when we cough, we generate blood droplets, usually large enough that the covering our nose and mouth may help protect us from that. But that's another similarity, I would say, in terms of how they look like. In terms of symptoms, they are very similar. I mean, I don't think that you can say, oh, based on these symptoms, I know that this person has the flu versus this person has COVID-19. There may be some characteristics once you get more information, like laboratories and or an X-ray, or for people who are very sick, a CT scan, which is just a more complex type of image that you can get from your chest and lungs, right? So if you get that, you will find some characteristic patterns that have been described for COVID-19. But in general, for most people, they could be illnesses that are very hard to differentiate one from the other.
The next question is, how can I prevent getting COVID-19?
Yeah, thank you for asking that question. Yes, some of the things that I would like to highlight is, right now, you need to stay home and keep your distance. It doesn't matter if someone is not sick. And that was the concern I was bringing up. People are concerned, and we don't know to what extent this is happening, but we know that people who are not symptomatic, they don't have symptoms. There are some people who can be infected, and still, when I talk, you can smell my breath, you're already probably inhaling some of those droplets that I'm talking about. So that's a way that may not be as important, but in the middle of a pandemic could be a way in which the disease could be spreading in spite of following some measures, right? So that's why distance is so important. So try to keep those 2 meters or 6 feet of distance. Doesn't matter if the other person is not sick. So if you are gathering with your loved ones and your family in large groups, I understand that we are Hispanics, we have large families, and that could be a situation that in which someone may be having an infection, they don't know yet, maybe they haven't developed symptoms, and could be transmitting the illness. So as I understand that we still want to show appreciation and love to our families, and there are ways to do that, which is what I've been discussing with others. Social engagement. You still can get socially engaged while keeping physical distance. So I would advise that people do that. And I'm highlighting that because people are more familiar with the other ones. I mean, early on, since this pandemic, even before this was declared a pandemic, I was trying to spread this message for people to protect from respiratory virus in general. I hope some people received that early message, but I don't mind to repeat it right now. Wash your hands, don't touch your face, cover your cough and your sneeze, keep the distance, and stay at home.
The next question is, if someone develops flu-like symptoms, what are the next steps that should be taken?
Well, you have to follow all these precautions so you don't infect anybody else. It doesn't matter if it's COVID or not, right? Flu-like symptoms could be COVID, so could be flu too, right? So if you are starting to develop those symptoms, you're not severely ill. If you're severely ill, you need to call EMS or call your doctor if that's if it's something you can do rapidly. But in general, what you could do is we have the self-checker link in or UT Health Rio Grande Valley. So that's linked to the CDC self-checker. So I will advise that people use that resource, or you can go directly to their website too. Click on that and go through all the questions. That can help you understand why, if you are likely, because your question, I think, is in the direction of if I'm concerned about having COVID. Is that right? Okay. So that can help you get some understanding of what your risk level and risk assessment, and it gives you very useful recommendations about what to do in terms of not infecting other people, right? That's very important. We all have that. moral responsibility, I think, to protect the public, right? So, but the next step after doing that, what you could do is call your doctor. If you want to call your doctor first, that's also an option. And then your doctor should help to guide you about what to do.
Okay. Well, thank you, Dr. Maldonado, for answering those questions and explaining to us what's going on in regards to COVID-19 and how we can protect ourselves. Thank you.
It's a pleasure. Thank you, Dimitra.